My name is Vanessa Riley. I am a doctoral researcher at the University of Rochester, president of the Global Nursing AI Alliance, and an AI strategist focused on cardiovascular health and emerging technologies. And I want to talk about something that is being celebrated as a breakthrough, but also needs to be understood more deeply. AI can now predict heart failure years before it happens. A recent development out of the University of Oxford shows that artificial intelligence can analyze cardiac CT scans and detect subtle inflammation around the heart changes that are not visible to the human eye. Using this approach, researchers have been able to identify patients at risk of developing heart failure up to 5 years in advance with remarkable accuracy. And on the surface, this is exactly what we've been moving toward: earlier detection, deeper insight, and a shift from reactive care to prevention. For decades, healthcare has been built around reacting to disease. We wait for symptoms, we confirm diagnosis, and then we intervene. But now, for the first time, we are beginning to see a shift where disease can be identified before it fully develops, and that is powerful. But this is where I want to pause, because prediction alone does not change outcomes. It creates awareness. But awareness without action still leaves a gap. And this is the part of the conversation that is not getting enough attention. Because if AI can tell us who is at risk years in advance, then the real question becomes, what do we do with that information? What happens after the prediction? Do we simply label patients as high risk and continue with the same models of care? Or do we fundamentally change how we manage that risk? Because this is where the real transformation in healthcare will happen. Not in prediction, but in what happens next. How do we monitor patients after risk is identified? How do we track changes in real time as physiology shifts? How do we interpret those changes in context? And most importantly, how do we intervene before deterioration occurs? Because that is the difference between AI as prediction and AI as true clinical intelligence. Prediction tells us what might happen. Clinical intelligence helps us understand what is happening as it unfolds and gives us the ability to act in time. This is especially important when we think about conditions like hypertension and cardiovascular disease, where risk is not static, it is dynamic. It changes based on stress, sleep environment, behavior, and physiology over time. And yet, our current systems are still largely built around snapshots, single measurements taken at isolated points in time. So even as AI advances, we are still trying to apply it to models of care that were never designed for continuous understanding. And that is the gap, not a gap in data, not a gap in technology, but a gap in how we translate data into meaningful, timely clinical action. We are entering an era where AI can tell us who is at risk years before disease develops. But the real opportunity and the real responsibility is building systems that can act on that insight. Systems that can monitor, continuously interpret changes as they happen, and guide intervention before patients reach a point of crisis. Because if we stop at prediction, we are only solving part of the problem. The rest of the work is in building intelligence. So the question is no longer, can AI predict disease? We are already there. The question now is, what should the system do next?